Thank you. Ms. Underwood.
Thank you, Mr. Chairman. Dr. Califf's testimony for today's hearing acknowledges the FDA's authority to regulate all tobacco products, including e-cigarettes. However, FDA has failed in this critical mandate. The agency will point to determinations that it's made on 99% of applications submitted by e-cigarette manufacturers. And while that figure is true, it's misleading. The list of thousands of applications FDA still has not reviewed includes the products that are most popular with kids, including applications from Juul and Vuse, which made up more than 40% of the market of e-cigarettes used by high schoolers in the most recent National Youth Tobacco Survey. FDA was required to complete all of these reviews in September 2021. It missed that deadline. Then in 2022, the agency admitted it would not complete these reviews until June 30th of 2023, nearly 2 years after the court-ordered deadline. Now, FDA has delayed the completion date again to December of 2023. Dr. Califf, I asked you about the delay during last year's hearing, and you blamed the agency's lack of funding. I understand and I share your position that FDA should have additional resources to complete these reviews. But prioritizing other work with the resources you have is a choice FDA is making, and it's a choice that's harming kids in our communities. Dr. Califf, I know the FDA's budget includes a request for an additional $100 million in user fees, including fees from e-cigarette manufacturers. I support that request, but we both know the challenges of passing legislation this year to give FDA that authority. Will you commit to prioritizing the health of children and completing all pre-market tobacco product application reviews by the December 31st, 2023 deadline FDA promised, even without additional user fee funding?
I appreciate your perspective, and I'm not contesting your portrayal of the two sides of the coin. We've reviewed 99% of 27 million products. That still leaves a few 100,000. And the big players who have the smartest, most well-paid lawyers are the ones that we're dealing with. And so we have to get these right because we're tied up in court with almost all of these people, even after we make our original decision. And I would point again to this summit coming up with the Justice Department is really critical about how we work our way through this effort. But to your primary question, will we prioritize the health of kids? The answer to that is unequivocally yes, we will.
Will you promise to prioritize the complete review by December 31st of this calendar year, even without the additional funding and user fees?
Yes, we've committed to meet that goal, which we've established after a pretty careful review of what's ahead of us.
Okay. The Consolidated Appropriations Act of 2022 included a provision clarifying FDA's authority to regulate synthetic nicotine products. These products cannot be marketed in the United States without an FDA authorization, and to date, 0 synthetic nicotine products have been authorized. However, even though FDA has started sending warning letters and issuing financial penalties to manufacturers and retailers illegally selling these products, many remain on the market, including brands that are popular among young people. Dr. Califf, recognizing that FDA's previous actions have not gotten these kid-friendly products off the market, what additional steps are you considering to enforce the law and to protect young people against synthetic nicotine products that are being sold illegally?
I know I sound like a broken record here, but just very quickly, when someone is on the market illegally, we have to document that's the case. Then we have to send a warning letter. Then we have to document whether they responded to the warning letter or not. Most do, but because there's so many, a fair number don't. Then we have to engage the Justice Department for enforcement. And there are issues as long as we're tied up in court about our ability to do that. I think this needs to be an emphasis of the entire government to figure out how to navigate this system. We want to get these off the market just as much as you. I walk by the stores right next to the FDA, as is documented, just like everybody else. But I can't just walk in and pull things off the shelf. There's a due process here that we have to streamline and make work across the government.
Dr. Califf, what I'm hearing you say is that it's hard. We understand that it's hard, sir, but we have to see this agency make this a top priority. We have a generation that we are losing the fight to tobacco. And we have existing regulations on the books that could stop it. And so I'm just asking for help here. The administration's regulatory agenda states that the prohibition of menthol cigarettes and flavored cigars will be finalized by August of 2023. These rules will save lives, particularly among Black Americans who've been targeted by predatory marketing from the tobacco industry for generations. Can you confirm that the FDA remains on track to finalize these rules by August?
Yes, and if I could just say, I think we're all on the same team here in wanting to do something about this problem, and I'm asking for help too. I don't mind that you're getting on me about this. You should. That's your job. But we're going to need some help in some of these areas to get these things off the shelves. And when it comes to menthol, something I'm very concerned about going into next year is that when these rules are finalized and people that have been are addicted, it's a fierce addiction to nicotine, who are dependent on menthol tobacco. If you just ask the question, where do they go to get help coming off of a terrible addiction? Our healthcare systems are not set up to deal with that right now.
Dr. Califf, I asked if you're going to finalize them by August.
I said yes.
Thank you so much, sir. I yield back.
Thank you very much. Ms. Hinson?
Thank you, Mr. Chairman, and Ranking Member